Hey folks, Dr. Joe Esposito here. So glad you could be with us today. What we're talking about today is something that's really timely, seasonal affective disorder. You're thinking to yourself, but Dr. Joe, I do not know what that means. SAD, seasonal affective disorder, it's a type of depression that returns around the same time every year, usually late fall to early winter. Now we're kind of a few weeks into winter here. When there's less sunlight and the days get shorter, some people get it in the spring and summer, but that's not as common. So we actually respond to our environment. And this is not uncommon to see when people get the winter blues. Now, what happens is, of course, we have the winter solstice, and then the days start getting longer and longer. And it can happen at any time, though. And with seasonal affective disorder, it's a pretty big issue because people get sad. And when they get sad, they get depressed. And then many times happens around the holidays because people will have a big anticipation for the holidays, and especially this year being unlike any other holiday we've ever had before, people expect things out of the holidays. You watch the movies on those special channels where the couple meets and they fall in love and everything's wonderful and they kiss under the mistletoe at the end and everything's great and happy. Well, that's not real life. In real life, things happen, problems occur, people get sick, there's financial issues, you can't go see your relatives, the gifts you got stink. So whatever it is, many times people sink into this depression because of expectations. So some of the symptoms, you might feel tired, sluggish, and just have low spirits for a good portion of the day. It sometimes can last for weeks at a time. And you're thinking to yourself, I'm just having a bad day. Yeah, but when the days turn into weeks, turn into months, that's when you start to have a problem. You might find it hard to sleep, hard to concentrate, or enjoy your favorite activities. It's possible you'll even overeat and gain weight. We called it the COVID-15? What was it? The quarantine 15. The quarantine 15, where people put on weight through the quarantine, and then this year's especially was particularly taxing because you couldn't see your family. It's the first time in my life I wasn't with my mother on Christmas this year. So there are things that come into play, and then there's always the daily activities and the daily issues. There's job and there's family and there's work and there's paying bills, and if you live in the north, you might have snow and it's cold and you can't get out and do your things. And so all these things can really kind of pile up, and some people are affected really poorly, so really badly, I should say. So what you'll find is when you're running into people at this time of the year, understand that it may not be that they're just a jerk. It may be that they're actually suffering from this condition. So I think it's due to less sunlight at certain times of the year. It can trigger your body to change in ways, and it uses certain key brain chemicals. And we've talked about neurotransmitters many, many times on this show. The four major neurotransmitters, the chemicals in the brain, are glutamine, norepinephrine, GABA, norepinephrine, serotonin, and dopamine. Those are the four major neurotransmitters. And what they do is they make your brain function. They make you, you. So serotonin, for example. Serotonin helps you focus. Dopamine gives you pleasure. GABA, made from glutamine, GABA suppresses other nerves. And then norepinephrine gives you energy. But GABA, for example, 90% of your brain is suppressing the other 20%. 10%, I'm sorry, this is my math day, my New Jersey math. 90% of the nerves are suppressing the other 10%. And so when people start to have tremors, for example, I have patients that have these tremors. Sometimes it's called an intention tremor, where when they go to reach for something, they get a tremor. Or they may just stay still and have tremors. Their head may shake, their arm may shake. That's usually a sign that the GABA is not suppressing the other nerves that are firing off, causing the body to cause these tremors to occur. And so one of the things we try to do with people with tremors is we try to make sure we get their GABA levels up. And we can do that by giving them supplements. There are supplements we can give somebody. There are drugs, but the drugs many times have side effects. Sometimes you need them. I'm not saying don't take them. But many times it's a digestive issue because a lot of these tremors happen in the second half of life, and we're not digesting our food properly. So whenever I see somebody with tremors, I always start to think, wait a minute, I bet you there's something going on here with the body not breaking down proteins into amino acids. Amino acid glutamine becomes GABA, and GABA helps suppress these things. So we always have to look at what the cause is, not the symptoms. I just had a patient earlier today, yesterday actually, I forgot, and she said, my doctor says my blood sugar is just a little higher than it should be. Like right around 80 to 100 is good blood sugar, and hers is like 106. Immediately wanted to put her on medication. Now, I'm not an endocrinologist. I always respect what the other doctors do. But I said to her, did the doctor give any other suggestions? No, nothing. Just got to take the medication. There's nothing I can do but take the medication. Now, I don't know if she was telling the truth or not. I'm just relating what she said. So I said, if we can stabilize your blood sugar through diet, most people, major majority of people with type 2 diabetes don't need to take medication. And she said, that's why I'm here, because I want to get to the cause of the problem, not just treat the symptoms. So with seasonal affective disorder, there are medications we can give you, antidepressants, but that doesn't fix the problem. We're going to go into what the problem is in just a second here. So fewer daylight hours raises the levels of melatonin and lowers the levels of serotonin, because remember, serotonin becomes melatonin. So if melatonin levels go up, serotonin may be depleted, and you get tired all the time. Melatonin helps you sleep. So when it's dark, your brain says, yes, it's time to go to sleep. When it's light, the brain says it's time to wake up, normally. So we're messing with the neurotransmitters in the brain now because we're just not getting enough sunlight. And that could really throw off your sleep patterns and then your mood. So who gets it? Who might be a high susceptibility to this? The farther you are from the equator, the more likely you are to get seasonal affective disorder. For example, if you're 7 times more likely to get it if you live in New Hampshire than if you live in Florida. So again, the further away from the equator, it gets darker sooner. Also, depending on what side of the time zone you're on. When I grew up in New York, which is on the eastern end of the time zone. So the sun came up early, set early. I remember when I was a kid, even grammar school, high school, 4 o'clock in the afternoon, it's dark. You know, you want to get out of school and get home before it got dark because the sun was setting. Now, if you're on the western end of the time zone, the sun's going to come up a little later and set a little later, about an hour. So where you live has a dramatic impact on the likelihood of you getting depressed in the winter. Anyone can have this condition, but people with family or personal histories of depression can usually have it worse, and their symptoms oftentimes worse. Women get it 4 times more than men. No idea why that statistic exists, but it's statistical. It is what it is. So how do you know you have it? Low energy. Could be a sign of several things, though. It's interesting. Patients come in all the time. Dr. Joe, I had a cough yesterday. You think I have COVID? I don't know. There are other things that are happening aside from COVID. There are other things that can make you tired. It could be a viral infection. It could be thyroid problems. It could be low blood sugar. Could be that you're not sleeping properly. So just because you're tired doesn't mean you have winter depression or winter blues. Lack of sleep and weight gain and feeling moody could be symptoms of seasonal affective disorder, but also could be hormone issues. It could be related to seasonal changes. So in our office, we sit down with the patients, and if they come in with with depression as one of their symptoms, we sit down and we say, okay, give me your family history. Give me your diet. What are you eating? Some people say, well, I'm an alcoholic. Okay, well, that's going to put a big strain on your liver. A very, very good friend of mine out in California, when I first met him, he was about 6'6", bodyguard. I mean, he looked like your typical bodyguard. Great build on him. And he worked with, he said, you know, don't mention names, but, you know, Frank Sinatra he worked with, and Britney Spears. So he was a well-known bodyguard. But he drank a lot. Now, I just heard from his girlfriend that his liver is in a state of failure. So he probably doesn't have seasonal affective disorder. He's probably got liver failure. So hopefully he'll pull out of it. The good news about the liver is that it's the fastest healing organ in the body. So if you start doing the right things, many times the organs can come back. So just because you have some of these symptoms doesn't mean you have COVID or you have seasonal affective disorder. It could just be that you've done things that have damaged your body. Our staff, we kind of work with the patients to try to decide what's going to be the best treatment. So we look at your diet, we look at your lifestyle, we look at your sleep habits, we look at your spine. Pain is exhausting. Anybody have chronic pain? It's exhausting. And so people come in, Doc, I'm tired all the time. Well, you can take supplements. You can take Dr. Joe's Super Greens, Dr. Joe's Essential Source, B-complex, nitric oxide, adrenal support. Those are the 5 that I recommend when people want to get boosts of energy. But then we'll say, okay, why are you tired all the time? Well, Doc, I've had this neck pain, these headaches, this shooting pain down my leg every day of my life for years. I had a lady come in a couple of days ago, and she has had headaches every day of her life, and she's 73 years old. She goes, I cannot remember a day I didn't have a headache. So, yeah, she was a little moody. She was a little edgy, but she's in pain all the time. So you got to kind of walk a mile in their shoes to see what they're dealing with. So we try to get to the cause, and if you think, well, Dr. Joe, I'm tired, I'm gaining weight, I'm staying home a lot, I'm depressed, maybe it's seasonal affective disorder, maybe it's other things that are really easy to treat. Like in her case, it was a pinched nerve in her neck. And we adjusted her, and after the adjustment, she sat up and she said, I don't know if my head doesn't hurt. I'm not sure. I don't know what it feels like to not have it hurt, unless she's on medications. So we'll see how that goes. Hopefully it'll get well. But many times people come in and they're depressed and they're drinking diet sodas. Diet sodas have aspartame in it. Aspartame is an excitotoxin to the brain. People are doing monosodium glutamate. And monosodium glutamate and aspartic acid, excitotoxics actually burn out the brain cells. And so the brain can actually start to shut down. So I get people off their diet sodas. I get them off their Chinese food. I get them off their processed foods. So many processed foods have monosodium glutamate, and then suddenly start to feel better. And they think I'm the smartest guy in the world. Well, I'm not smart. I'm just a good diagnostician. I can dig into things and say, okay, if this causes this, then what happens here? So I guess I am smart too. But we try to get to the cause of the problems. And when we can do that, the results are usually outstanding. Not everybody. I mean, there's maybe 5% of patients, 10% of patients that don't get all the results that they want. But in most cases, we get great results. And there's no reason not to fix the nervous system, fix the digestive system, and fix your diet. And the diet is going to be a biggie. I'm going to talk about that in a second when it comes to depression. Light therapy helps. There are actually special lamps you can do that replace the sun when you're stuck in winter months. So you can look up seasonal affective disorder lighting. Now, again, I don't know if it's going to be good or not. I can't give you a recommendation. I don't know any offhand. But these lights act like sun, but they don't give you the rays that are going to burn you, which is good. And so if you just do 20 to 60 minutes every day around this light, many times that's enough light to get the brain rebooted again. So that's a thought. I had somebody I knew, and she worked overnights. And so she had this issue. And so I said, well, what do we do about it? So she went ahead and got a light box and put it when she was getting ready in the morning, and she turned it on, and she did great. And so there are things that can be done to help reset the brain. And that's what I keep talking about so many times. It's resetting the brain. It's getting the brain to do what it's supposed to do. And the brain is a machine, and sometimes it short circuits or misfires. That's why we talk about digestion, which we'll talk about in a second. Getting the right nutrients to be digested and absorbed and utilized to produce the neurotransmitters in the brain. And that's oftentimes the missing link when it comes to any case of depression, anxiety, depression, ADD, ADHD, even people that are suicidal. Many times we fix their digestive system and the brain starts to work. We're going to cover that in a little bit. It's okay to talk about these things. Don't think, oh, I'm going to look like a wimp. I'm not going to look like I'm tough. It's okay to talk about these things. I support, if you need to, go to a therapist. Sit down with a therapist and let a professional work with you to help try to get to the cause of the problem. If you've never been to therapists, I think it's great. Because the things we're not taught in life, we're not taught how to take care of ourselves. We're not taught how to have a relationship. We're not taught how to make money and save money. Those are the three things that all of us have to go through. Whether it's a relationship with your coworkers, your friends, your family, your church members, we're never taught how to have a relationship, how to deal with issues in a relationship. And it's really important, I think, that people get taught that. I always said if I was Grand Poobah of the universe, I'd change a few things. And one of them I would do is I would teach kids in school a class on how to deal with relationships. How do you deal with people? Because people sometimes can be a little annoying. We got to talk about how to get ourselves healthy. And that's why this show on our website, drjoe.com, we have over 1,500 hours of podcasts. And if you if you want to follow a podcast service, whatever your favorite one is, just look up Dr. Joe For the Health of It. For the Health of It is the name of our podcast. And you can download as many podcasts as you want. You can get it from our website, download it from our website. So there's tons of information that I'm trying to do to teach you how to take care of yourself. And then how to make money and how to save money. And that's a biggie. And so that's not something I'm up for. Clark Howard, of course, at WSB Radio, he's the guru on saving money. But those are the three things I think we all need. And if we have those three skills, chances are we're going to have a lot less depression in our lives. And if something like seasonal affective disorder comes along, we're able to deal with it a lot better. We're all affected by it. How many times you say, oh, gosh, it's so dark out. I can't believe it's so dark already. I just want to go home. I don't even feel like doing anything. Everybody says that. So we're all affected by the seasons, but we just have to know how we process it. So talking to a therapist is not a bad idea. If it becomes a real issue that's affecting your life or your family's lives, your friends' lives, it's not a bad idea to do that as well. I do want to talk about how the brain works, and I talk about this a lot on a lot of shows, but we have people listening all the time, new listeners all the time. So your stomach has one major job. And the stomach's job is to take proteins and break them down into something called amino acids. Now, the amino acid named tryptophan becomes serotonin in your brain. Serotonin becomes melatonin, which helps you sleep. So if you have too much melatonin, you're using up the serotonin. If you don't have enough melatonin, you may not be making enough serotonin. So you got to get the digestive system working. So if you have acid reflux, heartburn, burping, gas, bloating, constipation, diarrhea, these are signs your digestive system isn't working. Do not ignore them. This is just like you're bleeding as far as I'm concerned. If you're bleeding, you're going to do something about it. If you have a lot of digestive issues and it's a regular thing, it's a real serious symptom. So you might want to come see us for that. Let's see if we can get the digestive system working. Sometimes we need to actually adjust the stomach. The stomach sits below your diaphragm and it can push up into the diaphragm. My team of doctors are trained by me to adjust or pull the stomach down away from the diaphragm. And when that happens, the stomach relaxes and starts digesting proteins more efficiently. I also recommend you take a digestive enzyme if you're eating a cooked meal. In the winter, we don't eat as much raw food usually. Some people never eat raw food. But if you're eating a totally cooked meal, I recommend Dr. Joe's digestive enzymes. I take one every time I have a cooked meal. My friend Larry loves my split pea soup. So I make split pea soup and I give a bunch to Larry, and he's very happy. And I'll have a bowl or two myself. I enjoy my own split pea soup too. So I always take a digestive enzyme with that because it's going to digest the food more efficiently. Anytime I have a cooked meal, though, it's a digestive enzyme. And those digestive enzymes are on the website, drjoe.com. Strongly advise you do that because that's going to help you break down your proteins into amino acids. So tyrosine becomes dopamine. Dopamine gives you pleasure. And many times when I see patients that are depressed, they don't have a lot of pleasure in their lives. And so we've got to get the pleasure levels up. We can easily do that in most cases by getting the proteins to break down to amino acid, the tyrosine becomes dopamine, and then dopamine gives you pleasure again. So I do recommend if you have these issues, always look at your digestive system. It's the one thing everybody seems to ignore, and for some reason it's the most important thing. And many times we fix somebody's digestive system, it's crazy how happy they are. People bring their children to us all the time, and adults with ADD, ADHD. Fix the digestive system, and then get them on good foods. Because even if we fix the digestive system and they're still eating alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener, they're not going to get the nutrients that they require. So that's why we get people on things like Dr. Joe's Super Greens and Dr. Joe's Essential Source, which, folks, that's the minimum supplements you should be taking every day. Everybody across the board, even children, people send all the time, well, Dr. Joe, I have a 3-year-old, a 5-year-old. How much should I give them? Give them a quarter dose, a half a dose. It's a scoop. Just give them a little bit. Put it in their foods. And it's amazing because it has enzymes, it has prebiotics, probiotics, a complete multivitamin. That alone, people respond tremendously to just by getting food and nutrients, nutrients into their diet. Some people consider like cookies, cakes, donuts, and pastas food. Not really. It's junk. I want nutrition. Whenever I think of food, I think of what's nutrition, what's going to get my body working better. So Super Greens an essential source, cooked meals, digestive enzymes always, and just those raw foods alone, you're going to see, in most cases, a big change in somebody's attitude, including children. With ADD, we may have to adjust their stomach, or with anxiety or depression, we adjust the stomach, pull the stomach away from the diaphragm. Now they start digesting their food. So when you have something that isn't working right in the body, whether it's headaches or neck pain or back pain or shoulder pain or acid reflux or ADD or ADHD, emotional disorders, folks, those are warning signs. Your body is screaming at you, hey, this is a warning sign. Pay attention to me. It's like a fire alarm going off. You wouldn't shut off the fire alarm, would you? Fire alarm's going off? No, you'd say, okay, where's the fire? Put out the fire, not the fire alarm. And many times we put out our fire alarm that we call symptoms without ever putting out the fire. In our offices, we try to get to the cause, not just treat the symptoms. And if you do want to make an appointment, folks, you can go to our website, drjoe.com, and book an appointment. We'd love to have you as a patient. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. drjoe.com, right on the front page. You can book an appointment right there. You can call us if you want to, book an appointment there. Normally, the first visit is $375. That's an exam, x-rays, consultation, first adjustment. And then the second visit going over the x-rays and doing a complete nutrition evaluation. We've reduced that to $199 through COVID. So we're trying to make it more affordable for folks to come in, and people are loving it. Treatment after that, we accept most insurances, car accidents, sports injuries, workers' comp injuries. If you've ever been in a car accident, ever, if the car was damaged, you were damaged 100% of the time. So you definitely want to get in to see us right away because the longer you wait, the more complicated the insurance company can make this for you. That's a little thing they do to you. Well, you weren't hurt. You didn't go to the doctor. Well, I was in a coma. You know what? I mean, I had one lady, I think I told the story before, her father died. She had to go to the funeral. She came back and the insurance company said, well, you didn't go to the doctor. We're not going to pay your claim. It's like, but my father died. And she actually had to get a death certificate to send to the insurance company for them to even consider it. So the insurance company's job is to try to get out of paying, and your job is to make sure you do everything you can to they don't do that. So if you do want to come see us, drjoe.com. We'd love to have you as a patient. Marietta, Duluth, Stockbridge, and West Cobb. Another thing we have to look at, what am I going to talk about, folks? You listen to the show. What's the one supplement I talk about every show? Vitamin D. Research, there's some mixed results on this. People typically have less vitamin D in their blood in the winter, and doctors don't know if that's actually a cause, but there are some studies showing that vitamin D supplements help make people feel better, and so there's no reason not to take it. That's the nice part. Vitamin D, as long as you're taking it within reason, is not a problem. I take 5 drops of Dr. Joe's vitamin D every single day. Unless it's the summer, I'm going to be outside a lot, I take 5 drops a day. Now, if I start to feel under the weather, if I start feeling sick, which very seldom happens, I will take 50 international units, 50,000 international units, which is 50 drops of vitamin D for 3 days. And then I cut back to 5 drops or 5,000 units again after that. But there's studies now, even with COVID patients, they're giving them mega doses of vitamin D short term and seeing some really good results. So I'm not saying I have a cure for COVID. I am saying that this is something that you should be doing every day. It's the cheapest insurance policy you'll ever buy. So if you're not doing vitamin D on a regular basis, you really should be. It's really important you do that then. There are little things you can do to manage your symptoms. Connect and spend time with others. I know sometimes it's tough. I want to go home at night. I don't feel like going out. I don't feel like socializing. Sometimes I have to force myself. Now, normally I'm pretty active between lectures and radio shows and TV shows and meetings, but there's certain stretches in my life where it's just like, I just don't feel like going out. I will actually force myself. I'll connect with some old friends that I hadn't seen in a while. So let's get together. So I have to be the initiator. And many times the friends will say, thank you for calling. I really need to get out of the house too. Hey, let's do this on a regular basis. And we'll go out and do our things. So it's really important that you connect with other people. Exercise is really important. Get moving. It can really lift your mood. Do it outside if you can, of course, but if you can't, just clean the house. Last weekend, I just had a total domestic day. I spent the whole day cleaning, mopping, vacuuming, doing windows, laundry. I went outside. I did some stuff outside. I cleaned up my garden a little bit with some dead plants that were in there. Felt great. So you don't have to necessarily hit the gym to get exercise. You can clean your house. Save some money too. Wash your car. It's a little cold, but I mean, vacuum your car. Get out there and do things. And eating a balanced diet is the most important thing you can do. I want most of your diet to consist of fruits, vegetables, nuts, and seeds. I want you to stay away from the 7 deadly sins: alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. Now, if you don't know what to eat, because now a lot of you are saying, I don't know what to eat, Dr. Joe. That's my whole diet: alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. Go to our website, drjoe.com, drjoe.com. Type in the words in the search bar, 7 Deadly Sins of Nutrition. Listen to that lecture. We did that one in California, a big group out there. I was guest speaker, a bunch of other famous people there. Listen to the 7 Deadly Sins of Nutrition. Then type in the search bar, so what can I eat? And listen to the show we did on so what can I eat? We talk about what you eat, what you don't eat. It's free. Website's free. Okay, you can spend as much time as you want there, as long as you want. That's going to give you a lot of good information as to what to eat and what not to eat. And if you start getting seasonal affective disorder, some people get it in the summer. Not a lot, but it's usually a winter thing. It might be different. You might get agitated or anxious. You might feel depressed. You might start craving certain foods. You might stop eating. All of these symptoms, if it's off your normal pattern, once again, these rules apply. So if you want to get well and stay well, normally functioning nervous system, normally functioning digestive system, good nutrition. The website, again, has over 1,500 hours of podcasts. Type in what you're looking for. If you have a question, there's going to be a little bot that pops up and says, hi, how can we help you? Send me your question. I'll get back to you as quickly as I possibly can. And I know a lot of you are on the website middle of the night because I get the questions 2, 3, 4 o'clock in the morning. I'll get back to you as soon as I can. If you want to make an appointment to come see us, drjoe.com, the website. You can book it right online or call us. We accept most insurances, car accidents, sports injuries, all the supplements we talked about available on the website, or come to our offices, pick them up, save some shipping. I'm Dr. Joe Esposito, drjoe.com. Don't go anywhere. We're going to be right back. Hey folks, Dr. Joe Esposito here. So glad you could join us today. If you stayed with us, thank you. If you're just joining us, welcome. First part of the show, we talked about a seasonal affective disorder. What happens with the winter blues. And it's a real thing, and it can be a very serious health issue. It's a symptom. And when you have symptoms, whatever the symptom is, I always say let's get to the cause of the problem, not just treat the symptoms. Now, sometimes you have to treat the symptoms. You've got a headache, take an aspirin. I'm okay with that, but then find out why you have a headache. That's always the thing is, yes, I want to get the person comfortable, but I also want to find out why they're having these issues. And so if you missed that part of the show, it's on the website, drjoe.com, and you can catch it there. Our podcast is called Dr. Joe for the Health of It. So whatever podcast service you use, just look up Dr. Joe for the health of it. And we have tons and tons, hours and hours and hours of podcasts. So you can binge Dr. Joe podcast, which is kind of cool. I want to talk this part of the show about fingernails. How's that for a boring topic? No, fingernails can tell you a ton of information about your health. And a lot of times people come to me and they'll say, well, Dr. Joe, I got ridges on my nails are white, my nails are yellow, my nails crack all the time, my nails don't grow. These are all symptoms that something's going wrong. So let's go through these, and everybody, I promise, everybody's going to be looking at their nails through this segment here. I did some work in my yard the other day, and I sprayed some sealant, some foam sealant. I got it on my fingernails. So if you look at my fingernails right now, it looks like I've got I don't know, algae or something growing on it, but I know what that is. So if your nails are pale, your nails are really white, it could be a sign of anemia. And a simple test is this. Squeeze your fingernail and then let it go. It should come back to being pink again relatively quickly, 2, 3 seconds, 4 seconds. If you squeeze your fingernail and it stays white, that could be an issue. So it could be anemia, which is not enough iron in the blood. It could be a sign of congestive heart failure. It's not the only sign, but it's a sign. Another sign of heart issues is if you have a crease in both your ears, in your earlobe. A crease in the earlobe could be a sign of heart condition. Now, it's not a definitive diagnostic test, but these are just things to say, I better start looking into this. Could be a sign of liver disease, could be a sign of malnutrition. So if your nails are pale, and if you squeeze them and they stay pale, they don't spring back to pink, that becomes a big issue. If the nails are white with darker rims, this could indicate liver issues such as hepatitis. So if you start to see the white nails with darker rims, that could be a sign, hey, maybe something's wrong with my liver. Now think about this. You might have hepatitis, but you think, okay, I've done nothing that could have given me hepatitis. I haven't used any used needles. I haven't gotten any tattoos. I haven't done drugs. And so maybe you just have white nails. Maybe it's just pale nails. You're anemic. But these are just little tools. And I teach all my doctors. When I teach my interns and my doctors now that aren't interns anymore, that are practicing doctors, when I teach them these things, I say, we're like the detectives. We've got to piece together all the information a patient gives us and try to get to the cause. Sometimes we're wrong. Sometimes we're not 100% right. Nobody is. There is no foolproof technique in medicine or healthcare that you're going to say, yes, I have pale nails, so obviously I have this problem. But these are all little pieces of the puzzle that we put together. And my team of doctors, we're really good at this because we all work together. Every time my doctors are in the office, we meet. I'm constantly meeting with all my doctors and saying, okay, I got this case. I'm not sure what to do with it. Look at this on the x-ray. What is this? We saw something the other day. It looks like a worm in somebody what would have been their stomach. I don't know what this is. So we sent it out to a radiologist because it was something that we couldn't diagnose. We sent it out. We work with a team of great doctors. We work with neurosurgeons, vascular surgeons, orthopedists, neurologists, therapists, life coaches. So we work with an amazing group of folks that we're there. So if we can't handle it on our group, we usually know somebody who can. Usually, not always though. Yellow nails. This common sign is usually a fungal infection. As the infection worsens, the nail beds may start to retract and the nails become thick and crumbly. You ever see this? Older people seem to get this a lot. In rare cases, yellow nails could indicate more serious conditions like thyroid disease, lung disease, diabetes, or cirrhosis. But nail infections usually come from the inside out, not the outside in. So you can treat them from the outside in. There's medications you could put on them. You can take slices of garlic. My grandmother taught me this one. Slices of garlic and just put a Band-Aid around the nail and sleep in it overnight and do that. It's going to take several weeks. And many times that will knock out the infection, but the infection is usually coming from your colon. It's what's called a systemic yeast infection in many cases. A lot of people have systemic yeast infections. Candida albicans is the fancy word for it. And what happens is sometime in your life you did a lot of antibiotics. Could have been from eating commercial meats and dairy products. It could be from taking antibiotics as a medicine. It could be from chlorine in your water, which acts as an antibiotic. It could be from yard work if you're spraying glyphosate or chemicals on your lawn or something and getting it into your body. And so these things kill off a lot of the good bacteria as well as killing off the bad bacteria. They don't seem to affect yeast. Now, yeast lives in your colon, and yeast's job is to take sugar and break it down, digest your sugar for you. So if the yeast isn't killed off, the yeast starts to overgrow. And then it can burrow a hole in your colon, because many places in your colon, it's only one cell thick, get into your blood system. Now the yeast is floating around your blood system. And the yeast has something on it called a biofilm. What a biofilm is, it's a coating that your immune system doesn't recognize. So your immune system will float by and say, what's that down there? Ah, it looks okay, and keep floating and not attack it. So the yeast protects itself with a biofilm. Now the yeast floats through your blood system, and it says, I want to set up shop someplace warm, someplace moist. Where can I find a warm, moist place on this body? Well, your fingernails, your toenails especially, are a really good spot because your feet are in socks all day. The vagina, the anus, the mouth, the ears, under the armpits. If you're heavy, if you're fat, you can have these rolls of fat where yeast can set up shop under there. So it likes to set up shop in warm, moist places because it likes to live in warm, moist places. And so if that's the case, we got to start looking at the colon. We got to say, why is the colon malfunctioning? What can we do to reestablish normal colon, what's called flora, which is the bacteria in your colon? So a simple test you can do, real simple test, is tonight when you go to bed, take a glass of water, just plain old clear glass of water, put it next to your bed. When you wake up tomorrow morning, get a big mouthful of spit. Scrape your tongue with your teeth, get a mouthful of spit into this glass. And this way you can see it. You wait up to an hour. If you start to see little tentacles coming down, like an octopus almost, that's usually a sign of systemic yeast infection. Now, we can do a micronutrient test on you, and we can determine if you have yeast infection. So we can dig a little deeper, but that's a good early diagnostic tool. And if you do have a yeast infection, a lot of you do, it's not something you want to ignore. It's a very serious condition because that yeast can get into your muscles, can get into your heart, can get into your organs, and can cause real serious problems. So if you have a systemic yeast infection, that nail fungus that you have, what's that called? It's a warning sign. It's saying, hey, something's wrong here, better fix me. And so you want to dig a little deeper. We have a yeast protocol that we can get to you. Can we put that on the website, Garrett? It's standard process. Can we put the whole yeast protocol on the website?
I can do my best.
Okay. And ask Kayla for it. She'll get it for you. And
Depends on if it's a PDF or how it is, but I can recreate it if not.
Okay, yeah, recreate it if you need to. And we can put that on the website then. And it's a supplements and dietary protocol as well. So if Garrett can do that, we'll put it on the website for you. And you definitely want to do that. It's not something you want to jerk around with. And you have to give up sugar. Breads, cookies, cakes, donuts, pastas, because sugar feeds the yeast. And so if you eat a lot of sugar, chances are you have a yeast infection too, because you keep feeding this yeast and it grows bigger and bigger and bigger. So I do recommend you give up the sugar, and we'll put the protocol together for you. And then you take a series of supplements and dietary changes. It does not go away easily. It can take a few months. But you know the nice part is you're eating healthy for a few months. No downside to that. Now, there are medications we can give you as well, but many times the medications have side effects like damaging the liver. So we definitely want to try to do this as naturally as we can if possible. So that yellow nail could be a sign that there's something really serious going on. If your nails are bluish or have a bluish tint to them, it could mean you're not getting enough oxygen. This can indicate a lung problem, emphysema, heart problems can be associated with bluish nails. So if you do have that, it wouldn't be a bad idea to get yourself to your cardiologist or at least your primary care physician and say, hey, my nails are blue. What do we do about this? And they could do tests for oxygen and things like this and see what the problem is. If your nails are rippled or pitted, it can be an early stage of psoriasis or inflammatory arthritis. Inflammatory arthritis, rheumatoid arthritis, is an autoimmune disease. Psoriasis, autoimmune disease. So whenever I see autoimmune diseases, I always think we got to get the body healthy. We got to get the immune system functioning normally. So my supplement protocol that I take for my immune system is Super Greens, an essential source, glutathione, and vitamin D. And then we're dealing with the colon issue here. You might want to also get on probiotics. Those are all on the website, drjoe.com. And that can be a serious issue. And again, if you just damage the nail, like I really hurt my finger, several months ago, I was digging up a big rock in my backyard, and I had a pick underneath it, and the pick slipped, and it crushed my finger between the rock and the pick, and the whole top joint of my finger was peeled back. You can see the bone. And I had gloves on, and I was like, this is going to hurt taking these gloves off. And as I took it off, it just peeled back the issue, the whole top of the finger. And boy, it hurt. You could see the bones, and it was disgusting. Immediately went where? To a doctor, medical doctor. This was not a chiropractic case, folks. This is a medical case. I needed a medical doctor. Went to a doc in the box. She looked at it. She says, it's a clean cut. She goes, it'll probably heal. We can patch it up if you want to and stitch it, but chances are you won't need stitches. I said, okay. Bandaged it up. It healed very well. I still have a little bit of loss of range of motion in there. But that was, and then the nail came back very weird. That's not an issue. I traumatized the nail. And so the nail had to grow a whole cycle to get normal again, and now it's normal. But again, in cases like this, that was a medical case. You know, you call me up and say, Dr. Joe, what should I do? I keep my immune system strong. I didn't eat sugar. I cleaned it very well. But yeah, you can approach it naturally to get the body to heal, but sometimes we need other interventions. So if you traumatize the nail, that's different. But if you see these things, then it's a real issue. If the nails are cracked or split, that can be a sign of a thyroid disease. Cracking or splitting combined with yellowish is likely due to a fungal infection if it cracks and splits with yellow. If it's not yellow, you want to start thinking thyroid issues. And we can do a thyroid panel in our office, by the way. If the nail fold is puffy, the skin around the nail appeals red and puffy, that's inflamed, usually a result of you damaged it. And so if you damage that area, again, you probably just need to be careful with it. If you pick at it a lot of people will pick at their nails. That'll cause infections. Bite your nails, that can cause infections. So just be careful about that. It's probably not anything to worry about. You just got to figure out, why do I have this? If you have dark lines beneath the nails, that should be investigated as soon as possible. It could be a melanoma, which is a type of skin cancer. So if you have dark lines under your nails, you want to get that taken care of right away. If you bite your nails, that could be a psychological issue. Nail biting or picking has also been linked to obsessive compulsive disorder or anxiety, and then we have to look at it, why are you biting the nails? The problem with biting the nails is you can get infections in your mouth. You can get canker sores in your mouth. You can put viruses, germs, bacteria in your mouth. So if you bite your nails, it's usually a sign of something. It's not the biting of the nails that's a problem. It's what's causing it. Many times we just need to do some stress reduction with that patient. We can get them on supplements. We can get them on magnesium supplements, try to calm them down, take a bath in not milk of magnesia, salt, Epsom salt. And the magnesium can be absorbed right into your body. And many times that's very relaxing to the body. So nails, again, are only just part of the puzzle. These changes are rarely the first sign. There's usually other things that go along with this. Again, it's not diagnostic or conclusive, but it's part of the puzzle that we put together. Many nail abnormalities are harmless. Not everyone with white nails has hepatitis. So if you have a concern about your nails, you can say, okay, let me dig a little deeper and see what's going on. Okay? I want to talk now about your breath. Yes, your breath. It's really been bothering me. I've been meaning to talk to you about it. I think it's time you and I had to talk. No, not your breath. But all of us are around people that have bad breath, right? And you smell it and you go, my God, his breath stinks, or her breath stinks. It's usually a sign of something else. Again, we're talking about symptoms today. And what are these symptoms of? So if you snore, that can give you morning breath because your mouth is open, you're breathing, you dry out your mouth. It could be a sign of an infection in the mouth as well. But snoring is usually due, what I find, the stomach pushed up against the diaphragm. The diaphragm is supposed to drop down when you inhale and go up when you exhale. And if the stomach is pushing up against the diaphragm, when you lay down, you don't have that gravity assist. And so without the gravity assist, you may not be breathing properly. And so every case I've ever had that snored, we check the stomach, we check the nerves in the neck because the nerves in the neck control the throat. So if you have neck pain, back pain, you've ever been in a car accident, trauma to the neck, many times you pinch the nerve that goes into the throat, and that can cause snoring as well. So snoring could be causing a bad breath, but what's causing the snoring? And that's when we dig a little deeper. Gum disease, if it has like a metallic smell, I always say there's two basic smells to bad breath. One of them smells like a latrine, try to keep it clean here, and the other one smells like chemicals. If it has a metallic smell, if it has a chemically smell, chances are it's gum disease. It might be called periodontitis, which is inflammation of the gums. You're more likely to have it if you smoke, you don't brush and floss regularly, and gum disease could be hereditary, but here's the danger of gum disease. The same sheet of skin, okay, that covers your gums also covers your heart. So if you have infections in your teeth and you don't treat it, it can actually go down into your heart and affect the heart as well. And so you don't want to jerk around with care of your teeth. I don't care if I have bad breath. I don't see anybody. It doesn't matter to me. No, it can affect the heart as well. And my father had heart disease. He had a mitral valve prolapse. But what happened was when he was young, he had rheumatic fever, and it wasn't treated properly. And so it spread from the fever, spread down into his heart, weakened the mitral valve. And so eventually, later on in his life, he had to have it replaced. But every time he went to the doctor, if he had any procedure done on his heart, he had to go to the dentist first to make sure there was no infection in the teeth that could be spreading into the heart. So you don't want to jerk around with teeth problems. You say, it's annoying, it costs, I don't want to go to the dentist, it's expensive. No, it can affect your heart and cause some real serious damage. Acid reflux can, of course, give you bad breath. So if you have heartburn, burping, gas, that can cause issues. We've talked about this many times. We can actually adjust or pull the stomach down away from the diaphragm. And when we do, many times that helps solve the problem. So if you have acid reflux, it's not just, hey, it's annoying, hey, I burp a lot, hey, I got to take medication. You got to fix that, folks. That acid can be eating away at your esophagus, and that can cause real serious problems. All my doctors are trained by me to how to adjust the stomach, and the reason is I have this condition. And when my stomach acts up, I got to get my doctors to adjust my stomach down away from the diaphragm. And so it's something that's usually manageable, but you definitely want to come see us and get that taken care of. If somebody has sweet breath, smells fruity almost, you might think that it's they're drinking alcohol. It could be a sign of diabetes. I remember years and years ago when I first started in practice, I had this older couple. They drove like two hours to come see me in this old pickup truck. And she had this amazingly sweet breath. You'd walk in a room and it smelled like fruit. And I thought, that's kind of odd. I wonder what that is. And so I looked it up and I said, you might be diabetic. And sure enough, she got checked and she was severe diabetes. And so we got that under control. So if somebody has this sweet breath, you may think that it's wonderful, but it could be a problem that you want to address immediately because that sweet breath can be something really serious. If you have a bacteria infection in your stomach called H. pylori, that can cause problems. If you have H. pylori, it's oftentimes due to not enough stomach acid. There's a bacteria in your stomach called H. pylori, and it lives in your stomach if you don't have enough stomach acid, and it can set up shop and actually cause an ulcer to form in your stomach. So when you have an ulcer, many times it's not that you have too much stomach acid, it's that you have too little stomach acid. And so we get people on betaine hydrochloride, Dr. Joe's digestive enzyme, Super Greens Essential Source, adjust their stomach, and in many cases, we get amazing results. If you have a respiratory infection, sinus infection, that can give you that nasty breath as well. And you've been around people with a cold, and they have that. There's a certain smell that people who have a sinus infection have in their breath. And I must have a super sensitive nose because I've been around people. I say, "You smell that?" No, I don't smell it. So I think I might be a super smeller. I don't know, but I smell things that other people don't smell. And many times I can be around somebody and say, "I bet you they're going to get a cold." And normally the next couple of days they do. Certain medications can dry out your mouth. Drugs like nitrates that treat heart conditions, chemotherapy for cancer, sleep aids. These can make your breath smell bad and break down in your body, so that's an issue. Tonsil stones. My nose is itching. Excuse me for a second. There you go. My nose itches. Tonsil stones. You have your tonsils back there, and you can build up little calcium stones in that area, and that can be an issue as well. So you can look in somebody's throat and see if they have the tonsil stone. And if they do, oh man, I got a real tickle in my nose. It must be dust in the air. You can kind of take a tongue depressor look, and you can see those little stones. Many times you could use like a toothbrush or a cotton swab and actually scrape them out. And they come out, you swallow them, it's no big deal. But that can cause like a little bit of infection in there as well. People with dehydration. Folks, you got to drink enough water. And here's the thing, most of us don't drink enough fluids, especially water. And the reason is this. When you were a baby, an infant, there was a part of your brain that controlled hunger and a part of your brain that controlled thirst. Okay, it's in the hypothalamus, if I remember correctly. As you become a toddler, those two parts of the brain grow together. And when these two parts of the brain grow together, you have a real tough time distinguishing between hunger and thirst. So many times when you're hungry, you're not hungry, you're thirsty. And so here's one of my tricks I do when I do my weight loss protocols, is I want you to have a big glass of water before every meal. And many times that helps solve that hunger, and you eat a lot less food. So if you're dehydrated, a simple test you can do is grab the back of your hand and squeeze the skin and let it go, and it should spring back relatively quickly. If it doesn't spring back relatively quickly, chances are you're dehydrated. Your pee should be clear. Unless you're taking Dr. Joe's B vitamins that would make it bright yellow, your pee should be pretty clear and not have odors in it. So you can actually pee in a clear glass and look at it. Does it have things floating around in it? Is it clear? Does it have an odor? Garlic might give it an odor too, by the way, and asparagus. But other than that, it shouldn't have an odor. These may be signs of dehydration. Just drink more water. So again, all these symptoms that we're talking about are nothing but symptoms. They're not the problem. They're the sign of the problem. So bad breath is a symptom. Let's find out why. Oh, you're not flossing, you're not brushing, do you have an infection? A friend of mine a while ago had an infection in his jaw, and his breath stunk. And we would tell him, your breath stinks. Oh, it doesn't stink. You know what you're talking about. And eventually the infection actually came out the bottom of his jaw. like a pimple, and it broke open, and pus was pouring out. And eventually he had to get that all fixed. Of course, it was a rotten tooth. So in our offices, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. We're always trying to get to the cause of the patient's health problems, not just treat the symptoms. So if you have a health issue, if you have neck pain, back pain, shoulder pain, headaches, numbness, tingling, sciatica, muscle weakness, folks, come see us. Stop suffering needlessly. Many times it's a chiropractic case. Sometimes, if the arthritis is bad enough, we can do something called PRP. PRP is platelet-rich plasma. We can take your blood, spin out the platelets, and re-inject it back into your body. And that causes what's called a healing cascade. It causes the body to recruit new healing cells. So people with shoulder arthritis, knee arthritis, spinal arthritis, any type of arthritis, many times PRP is your natural answer to your problem. Then we add chiropractic to it. Other places may do PRP, but we add the chiropractic to it to put the bones back in place. Then we add nutrition to it. Then we add supplements to it. So our offices really are a one-stop shop for wellness in most cases. So if you have a health issue, just make an appointment. Every day patients come in. I've been listening to you for 5 years, Dr. Joe, 10 years, 20 years. Oh my gosh, I've read all your books. Why didn't you get here sooner? And the answer is always, I don't know, I should have. So if you have a health issue for you, your friends, your family, your children, go to our website, drjoe.com. Just make an appointment. We have, again, offices all across the Atlanta area. First visit is normally $375. We've reduced that to $199. That's an exam, x-rays, consultation, going over the x-rays with you on the next visit, and doing a nutritional evaluation. The nutritional evaluation alone is $150. So just do it. We accept insurance for treatment after that. We accept almost all insurance companies, car accidents, sports injuries. If you've ever been in a car accident, ever, if the car was damaged, you were damaged 100% of the time. Do not wait. If you have an attorney who says, no, you have to go to my doctor, drop that attorney. The attorney has no right to say you have to go to a certain doctor. I just had that happen the other day, and a patient dropped the attorney. He said, no, I'm going to see Dr. Joe. Oh, no, you got to go see my doctor. No, you don't. Come see us. Don't waste time. The longer something is there, usually the harder it is to fix. So I said reflux, heartburn, pain, foot issues, knee issues. Just come see us. Go to our website, in fact, drjoe.com. We have a tab that says services. Hit that. It'll give you a drop-down menu. It lists many of the services that we have. We can do blood work on you. We have a weight loss protocol that we do, a 21-day weight loss protocol, doctor supervised. So we cover almost everything that we can to try to help people get well and stay well. So whether it's neck pain or back pain, we just talked about bad breath. Bad breath's a warning sign. Could be an infection. Could be liver failure. Could be kidney failure. If your breath smells fishy. If your breath smells fishy, it could be a sign of kidney failure. So you don't want to ignore that. So when you have issues, we want to be your doctors. I feel I work with some of the best doctors, if not the best doctors in the world. We have our medical division as well. We have a medical doctor on staff. The supplements we talked about, the minimum supplements everybody should be taking are Super Greens, an essential source, and especially in winter, vitamin D. All those supplements are on the website, drjoe.com. We can ship them to you. If you can come pick them up, better still, because it's going to save us some shipping costs. Save you shipping costs. Doesn't cost us anything. It costs you. So if you want to make an appointment, drjoe.com. Again, offices in Marietta, Duluth, Stockbridge, and West Cobb. We want to be your doctors. We want to get you well and keep you well. I'm Dr. Joe Esposito, drjoe.com. Thanks for tuning in. We'll catch you next time.